Hey everybody, Dr. Patel here, going over some more low back MRI. Um, Third part in the series. Today we're going to be talking about your facet joints. So, the first time we talked about what normal MRI looks like and going through various different parts of the anatomy. And last time we talked about your discs, the discs in the low back that are the shock absorbers. And today we're going to be going over the facet joints. What does normal look like, and what does it look like when we have arthritis? So, without further ado, let's get started. So, here's a model of the spine. I'm going to try to increase the size of this for you guys so you can see it a little bit clearer. But here's a model of the spine here, and here is the front of the body, the back of the body, top, bottom. These are the vertebral bodies, the bones, and this is the disc in between here. And when we look at the back, we have these right here on either side, which are your facet joints. Now, when we talk about what holds one vertebral body on the other, there are three things really. There's the disc in the front, and then there are the two facet joints in the back. And you can picture that each bone is stacked on the other with these 3 points, like a tripod. Okay. Now, these facet joints, well, in actuality, first and foremost, I got to say, they're actually called the zygaphoceal joints, also called the Z joints. But basically, this part of the bone is called the facet, and where one facet meets another facet, that's called the facet joint, right? Where one meets another. And they're oriented in a fashion that allows for movement to take place. And they're oriented in different positions for the lumbar spine or low back. They're oriented a little bit differently for the thoracic spine and differently for the different parts of the cervical spine to allow for different motions based off of the segment that we're at. Now, I mentioned before that disc degeneration occurs. What happens with disc degeneration is that water balloon completely filled with jelly starts to have a little bit less water in it, so instead of being nice and cushiony, it starts to get a little bit more wobbly. And if you think of each vertebral body held onto the other by the disc in the front and the facet joints or Z joints in the back, then you can imagine if this water balloon is getting a little bit more wobbly, there's more motion that's taking place, or if that's really getting dehydrated or degenerated and it's squishing down, then ultimately more pressure, more friction, etc. is going to take place at these facet joints. So over time, the smooth surface called the cartilage starts to wear away, then the bone starts to get a little rougher. And in fact, as that bone starts to change, the direction of the facet joints can actually change. And an activity that's called facet tropism, the direction of those facet joints can actually change because as there's more friction, their bone is like, hey, I gotta change my position to allow for this motion that's taking place there. And as that occurs, that's what can allow for some slippage of one vertebral body on the other or some movement that can then take place there. So what's interesting about this all is that facet arthritis does not need to equal pain. In fact, it's very, very common for us to have facet arthritis and have zero pain associated with it. But when we have that facet tropism taking place, or even in the absence of that, we have that facet arthritis taking place, it's easier for that joint to get irritated if we put abnormal pressure into that area. So when that occurs, then we can have inflammation that occurs in those joints, or we can have mechanical pain in those bones, and that can be an issue. So first and foremost, what does normal look like? Now, before, when we look at this vertebral body, we see kind of what the facet joints look like from the side. They kind of look like these lines between the two bones here. But when we look at it from the bottom up, we see a different animal. So this is kind of a view here. What we're seeing on the MRI image here is a view as if you're lying down on your back, and we're now looking at cross sections here. Okay, and you're lying down on your back. your head is actually past your screen and your feet are towards you. So this is the front of the body here. This is the back of the body. This is the right side. This is the left side. So let me draw a little bit on here so we are all on the same page. So this is the front of the body. This is the back of the body. This is the right side. This is the left side. And just kind of to review some of the things that we talked about last time, over here we have the disc. Right? This is the central canal where all the nerves are traveling. And these are the nerves that are traveling in the central canal and are going to exit on either side. Okay? And when we look over here, these on either side here are your facet joints. Okay? And the way that I like to describe them is that they kind of look like little hamburgers, right? If you look at them and kind of turn your head a little cockeyed here, if this is one of the bones, the facet joints, this is another bone, the facet, and this is the joint in between where those two bones or two facets meet, okay? And if you look at that, you squint your eyes just a little bit, you can see that that kind of looks like a little hamburger there. There's your meat in between the two buns, right? Or for you vegetarians out there, there's your impossible patty or whatever. So in any case, that is what a normal facet joint looks like. In actuality, that facet joint actually has a little tiny bit of degenerative changes. And the way to kind of interpret that is if you look at this right-sided facet joint here, you can see that the contours or the edge of this facet joint is actually fairly smooth, right? So for all intents and purposes, this guy looks pretty darn good. But when you look at this one over here on the left side, this top part of the facet is pretty smooth here, but this one actually has a little bit of roughness to it, right? And that is maybe some early stages of some arthritis that's starting to occur there. Okay. Now, I want to point out what some more significant arthritis starts to look like, and I want to point out, oh, I'm getting some feedback, some comments. The volume is still too low. Let's see if I can fix that at all. Is that a little bit better? You tell me. But I'm not going to recap everything that I went through already, so hopefully you can rewind and pump up the volume, but you let me know still in the comments if it's still too low at this point. Yes, better. Okay, awesome. Thank you. This is the advantage of live videos, by the way, because if this wasn't live, then I'd recorded the whole thing and not recognized that it was low the whole time. Susan stopping in to say hi. Thanks so much, Susan. Thank you, Michael. It was okay enough to hear, just hard, but hopefully it's a little bit better now, so I will continue. So now that we know what kind of normal looks like, let's take a look at some abnormalities here. So this is an example here of a little bit of some worsening osteoarthritis here. I'm actually going to, let's see, make this a little bit bigger for us. So we look here, we're starting to recognize that there's some more irregularity of the bone that's starting to take place here. So you can see that the contours over here of the bone is starting to get a little bit rougher at both of these areas. So there's some tiny bit of arthritis that's starting to occur more with these hamburgers. These hamburgers aren't quite squished yet, but the hamburgers are starting to get a little bit more friction. The facet joints are starting to get a little bit more friction, and you're starting to get a little bit of roughness occurring in the bones there, okay? So here's another example here. And let's try to zoom this guy in a little bit more. And now we're not only seeing a little bit of increased roughness that's occurring over here, right? But we're also starting to see some changes in the bone itself. Okay, so as the arthritis starts to progress, there's going to be some more abnormality that starts to occur in the bone. Now, by itself, this isn't a big deal. We're starting to get a little bit of degeneration. That's not that bad. That's not something that I'm writing home about per se. When I start to get worried is when I start to see some abnormalities that are more offensive, that when those hamburgers are really starting to change shape, or if we're starting to see other things inside the joint that might be suggestive of irritation or inflammation, and I'll get into that in just a second. I want to show you another example of some arthritis in the joint here. So again, when we're looking at these facet joints here, you're actually starting to see some increase in the bone here. It's starting to bulk up, right? So this part of it is relatively smooth for all intents and purposes, but this part you're starting to get some bulkiness of the facet joint. And although this isn't quite a symmetric picture here, you're starting to see that this facet joint is actually looking a little bit larger than this one, right? So there's some asymmetry going on in there that's causing some increased pressure onto one side versus the other. So this next picture here, now we're looking at a facet joint that for all intents and purposes is not horribly arthritic, but has something different in it. So what's the difference that we see between this facet joint and the other one? We're looking at this joint here versus this joint here. Again, it's a little bit of an asymmetric cut, so we can't completely do apples to apples here. With this joint on the right side, you're getting a little bit of roughness to it, but otherwise it's not a horrible looking hamburger, right? Still looks like a little hamburger over there. But on this side, on the left side, even though the margins are relatively smooth, right, and the buns look pretty good, we're seeing instead of hamburger meat, this is just straight up a cheese sandwich, right? This is all white in the center here. And I think that it's fair to say that there's clear difference between this side and the other. So what is that white stuff in there? Well, that's actually, in this cut, it's inflammation. So fluid in this sequence, which is called a T2 sequence, fluid shows up as bright white particularly. So that white that we see inside that facet joint is actually some inflammation or some fluid inside the joint. Now sometimes it's normal for us to have a little bit of fluid inside a joint. Every joint has a little bit of fluid inside of it. But when you see that asymmetry from side to side, when you see one side that has white in it, the other side that's relatively dark, particularly if this corresponds with the symptoms that the patient's having, right? If this patient came to me and said, "Doc, I have 0 back pain," then I'd say, all right, then this might be your normal. But if they said that they have back pain on their left side, and I did some physical exam maneuvers to show that there was anger or pain coming from the facet joints, and then I look at this MRI and I see that there's some inflammation inside the joint, well, that's telling me something, right? You gotta correlate what that is. Going into my comments here, Patty, can't get sound on, what do I do? Feedback from everybody else. If everyone else can hear me, then Patty, that might be a problem with your computer. You might be able to go down to the bottom right of your screen, click down there to look at the volume key and try to increase the volume. But otherwise, I'm not certain. Allison said, will an MRI that shows the facet joints look the same from the cervical spine to the lumbar spine? Great question. So the facet joints are actually drastically different when we look at the low back, the lumbar spine, versus the upper back, the thoracic spine, versus the cervical spine. They look drastically different. And that ultimately comes down to the point that these facet joints have to be oriented in different directions to account for the different type of motion that takes place in the different part of the spine, right? Because in your low back, we're doing a lot of flexion, we're doing rotation, we're doing side bending. So those facet joints need to be able to accommodate that. In the cervical spine, again, we're doing a lot of those different motions, but different segments actually account for different types of motion, and that's why the joints could be in different positions. The thoracic spine, there's actually not a lot of rotation that takes place there. There is some flexion and extension. So again, those facet joints are oriented completely differently in that region as well. Michael, thank you. Sound is good. Awesome. Fluid, what type of fluid? That fluid could be normal joint fluid inside the joint, or it could be inflammation. Inflammation, again, if you haven't heard any of my previous talks, inflammation is actually not necessarily a bad thing. In fact, it is one of the first parts of the healing process. Inflammation is, when you have an injury, inflammation is the influx of blood, growth factors, stem cells, things to help with the healing process, but that inflammation should ultimately come and then go. And if we have lingering inflammation in an area, that could be a sign of constant irritation to the joint. It could be a sign of arthritis and the local environment not healing properly. It could be several different things. And then Michael asks, is the crispy noise on rotation, is that arthritis, fibrosis, or tissue? The little snap, crackle, pops or noises that we hear when we move can actually be a variety of different things. For all intents and purposes, it could be normal due to some air pockets inside joints that are actually popping. It could be fluid or inflammation that bubbles when we move. It could be the grittiness of the bone itself if we do have substantial arthritis. It could be the ligaments, soft tissue structures that connect bone to bone that are kind of snapping if they are either A, loose, or B, injured. There's a lot of different things that can cause various different noises to occur inside the low back. Michael said that's why I said arteries show up as white circles. Some arteries show up as white circles, some as dark circles, depending on what exactly we're looking at. And Danny says, I have spina bifida occulta. I'm so sorry. I have a spondylolisthesis grade 2, had stuck SI joint problem, then MRI showed arthritis, etc. Very, very common for us to have arthritis, particularly in the setting of spondylolisthesis. Spondylolisthesis, if you go back to Facebook Live's episodes, I believe we talked about MRIs and what spondylolisthesis looks like on MRI. Spondylolisthesis is when one segment shifts forward or backwards in comparison to the other. There are several different types of spondylolisthesis, one of which includes degenerative type spondylolisthesis, when the facet joints are starting to rub and starting to get arthritis, and that facet tropism occurs, or the orientation of those facets start to change. That allows for more motion to take place. That could actually be an underlying reason behind spondylolisthesis. And Danny said that once the SI joint is released, back can crack, pop, etc. And manual therapy can cause, manual therapy like chiropractic, physical therapy modalities, osteopathic manipulation can cause various different cracks to take place. The osteopaths say that it's high velocity, low amplitude maneuvers that can cause that cracking sound. Chiropractors call it a cavitation for that to occur. There are various different things that can cause those cracking noises to occur. And it's not always so simple as, oh, it was my sacroiliac joint that cracked or my facet joint that's cracked, because depending on how precise of a movement that manual therapy is, or how global of a movement, it could be one or several things that make the noises that we hear. But going back to my image here, sorry Patty, sorry we're not able to hear hear us, but hopefully we'll get you that YouTube video, and maybe we can fix your audio by that time. But going back to the imaging here, that fluid that we see inside that joint, that could be indicative of either pain, that could be indicative of absolutely nothing. That could be a reason why we hear or feel some cracking type stuff in that region. Or it could just be a sign, even though we're not necessarily feeling pain there, it could be a sign of abnormal motion in that area that's causing some residual fluid or inflammation to stick around. So here's another example of some fluid inside the joints. Again, we don't know if this is or is not normal. For those of you that joined us last time, we could see a couple other things. Oh, I dropped my pen. All right, I'm back. We could see some other things here. I just want to point out we have our disc, right, that has this kind of broad-based disc protrusion. And for those of us that were there last week, here's that tear inside the annulus, okay? But what we see here are your hamburgers, right? A little bump there. Hamburger and hamburger. But again, this is more, both of these guys are more cheeseburgery with the joint fluid in between. You can see the right one is a little bit bigger than the left one, but again, this might be the cut or the angle of the MRI that we see. The other thing that I want to point out, and I'm kind of foreshadow to a future video here, the other thing that I want to point out is this atrophy that's taking place on one side more than the other. An important hint that something's going on a little bit more on the right side than the left. But back to the facet joints. Ultimately, in this picture here, what I wanted to point out is that we have joints that don't have severe arthritis, but you clearly have a little bit more joint fluid on the right side compared to the left. And then the last one that I want to show you, nope, not this one. This one I want to show you is an example of a facet joint that has a little bit of what's called a cyst. So when you look at this right facet joint, again, relatively smooth, maybe a little bit of roughness to the border there, but otherwise, for all intents and purposes, pretty good. Purposes pretty good. Here is the facet joint here. Again, a little bit dented there, a little bit of stuff going on right there. But then you see this guy. You see this guy right here. That little bright white circle that we see there, that little bright white circle is a little pocket of inflammation or a little cyst that is formed right off of the facet joint. So what is a cyst in this setting? The facet joint, like any joint, has a joint capsule. So a joint capsule, and I'll go back to one of these previous images here. A joint capsule is kind of ligament-like structure that surrounds the joint. So imagine it as a balloon. Imagine it as a balloon that essentially surrounds the joint and that keeps all the fluid inside. And that balloon sits there, and that can get injured in various specific situations, right? The most common injury to the capsule that we think about, theorize, is when somebody has a neck injury, like a whiplash condition, and that ligament can actually get stretched. That facet capsule can get stretched. Same thing can happen in the low back as well. But imagine that as being a kind of balloon that surrounds the joint, right? When we have inflammation, or if that balloon fills with fluid, then that fluid can expand that capsule somewhat. But if there's a little bit of weakness to the capsule, then there could be an outpouching of that balloon. So the way I picture this is, if you took a rubber balloon and stuck your thumb through it, not through it completely, but stretch the rubber a little bit, and then if you blew up the balloon, then that that little weakened part that you put your thumb through would actually bubble out a little bit, right? That bubbling out is essentially what a cyst is. And when we look at that here, we can see that that little white nugget that's sitting there is kind of a nugget of fluid that's kind of bubbled out from that facet joint. Talking about that, very common cysts that we think of are things like Baker's cysts, which are the cyst or pocket of fluid that occurs on the back of the knee, right? Again, our knee joint has a capsule that surrounds it, and that back of the knee area has a weaker part of that capsule in general. So if you have inflammation in your knee, if that knee fills with fluid, then it's easier for that fluid to kind of pocket in that back area, and that's called a Baker's cyst. And then finally, I want to show you what more severe facet arthritis looks like. So I'm going to zoom in on this guy some more. Michael, thank you for the comment there. And now what type of MRI is this? I have an MRI 3T that is still not clear as what you show here. Is it the cycle times they are running low? So a 3T MRI, whenever you see the like 3T or 1.5T or things along those lines, 0.3T. T stands for Tesla. That's the power, the resolution of the MRI. 3T is the current highest standard that we have commercially available in the U.S. currently, although there are in laboratory type settings, there are up to 9T or maybe even more at this point, I don't know, machines. There's a lot of machines that go down to even 0.3T or Tesla. And I like to get 3T MRIs, but there's a variety that are out there. Even with the 1.5 Tesla, we could still get really good imaging, particularly if the machine does really thin slices through the anatomy. Because even though the resolution might not necessarily be as good, if we get thin slices, then we're not missing things that are going on there. These MRIs that we're looking at are all over the place. Some of them have been 1.2, 1.5, and I believe this one is 3 Tesla here. So in this picture, we want to look at those facet joints again. Michael said, "Shame, my 3 Tesla is very blurry still." So 3 Tesla, why do your images, I'm on a side note here, why does your image get blurry? Well, there's a thing called motion artifact. So if you're uncomfortable in there, or if you're anxious, or if you're in pain and it's uncomfortable to sit there, if you're fidgeting a little bit, well, if you're fidgeting a little bit as the image is being attained, then that can cause what's called motion artifact and can cause it to kind of look blurry altogether. Other things that can cause issues in terms of imaging are if there are like hardware, if you have a fusion, or if you have surgery, or things that are placed inside the body, that could theoretically cause some issues as well. And yeah, Patty got some sound. Awesome. Claustrophobic, Michael, sorry to hear. Yeah, that's where medications come into play. Shaky definitely makes a difference. But let's finally look at these facet joints, because I think it's important for us to look what severe looks like. So again, kind of going back to what, let's see, what normal looked like for all intents and purposes, right? These are your more normal looking MRIs of facet joints. Let's see. So this is as normal as it's going to get, at least in my clinic, looking at what those hamburgers look like, right? Now, remember what that looks like, and here's what more severe is. So in the more severe facet joints, your hamburgers, for all intents and purposes, have gotten smushed. Right here is, a piece of that bread. Here's some of that bread right there. Right? And you can see how really this hamburger has been through a lot. This is where your hamburger meat is, essentially, and the joint is not only looking like it's smushed, but you could see how the orientation of the joint has changed. This orientation of the joint is actually more kind of in this direction now, versus this orientation of the joint is more in this direction. So based off of the different pressures that are being placed in that area, we've seen a change in the direction of the joint. This one here has some bulkiness to it here, right? Here's the bun. Here's some what's called sclerosis, or some breaking down of the bone there. And then here is a little cyst right here, okay? So again, here's your hamburger meat in between, or whatnot. And believe it or not, even though we've got all of this stuff going on in this facet joint, this patient, we treated her with her own body's PRP into those joints, and we were able to calm down the inflammation and calm down the pain associated with them. And at this juncture, these facet joints are actually not painful. So she has a little bit of residual nerve irritation from a separate level where she's got some disc bulging, and she has a little bit of residual nerve irritation into her right buttock. But she used to have more stuff going down her leg, which has improved. But the pain in the back associated with the facet joints has actually improved, and we did her treatment back in 2017. And so now arthritis is a one-way street, and we do expect this arthritis to gradually worsen, but there are things that we can do to prevent it from going downhill. Number one is exercise, 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 exercise. And walking is fantastic, but we also need to do specific things to strengthen our muscles, to take pressure off of the area. Nutrition, having an anti-inflammatory diet really, really plays a factor. And if we have little signs that there's still some irritation in the area, then we want to be proactive with things like PRP or prolotherapy to just keep those joints healthy. And not only the joints, but also the ligaments, the muscles, all the soft tissue structures that are surrounding it. Some unpublished data from one of my colleagues, Dr. Chris Williams, looked at data for patients that he treated facet joints with just PRP and just the facet joints, versus patients that he treated the facet joints, the ligaments, the muscles, the epidural space, the nerves, all of the things that are involved in the functional spinal unit. And by and large, when we treated the whole functional spinal unit, we have improved symptoms for a longer duration of time. So very, very important things to consider. Allison asked, is facet joint pain different than bulge pain? Would the bulge only cause pain if it is touching the nerve? Those great questions. And for more on disc bulges, look at my Facebook Live from last week, where I did talk about how to look at what different disc pathologies look like on MRI. But just because a disc is bulging does not equal pain. In fact, very, very common for us to have disc bulges and have zero pain associated with it. Over the age of 20 or 30, greater than 30% of people have disc stuff going on, even in the absence of pain. So a disc bulge can cause pain for a couple different reasons. If the disc has a tear in it, it could be a pain generator. And if the disc bulge is pressing on a nerve, it could be a pain generator. If the disc is pressing on a nerve, typically that pain could involve the back, but oftentimes is going into the buttocks or down the leg or into the hip, versus a disc tear, maybe specifically in the back, but it could cause radiating pain as well. Now in the textbook, when you bend forward, you're putting more pressure onto the disc. So theoretically, bending forward can cause disc-related symptoms. But bending forward actually takes pressure off of the facet joints, right? So looking back at this model here, if you bent forward, then you would take pressure off of the facet joints here, right? Versus bending backwards would put pressure onto the facet joints. So the directionality of your pain ends up being a factor into determining where your pain is coming from. But in reality, and what I want you to take home from all of this is that these things aren't in isolation, right? I started this lecture talking about how the facet joint arthritis oftentimes occurs secondary to a little bit of disc degeneration going on, right? In the absence of a specific trauma to just the facet joint, These degenerative changes that take place over time occur because of the whole system having issues. So yeah, we have these pain generators, which can be attacked with more traditional pain management techniques, right? Doing a cortisone injection at a facet joint, or doing a medial branch block at the facet joint, or a radiofrequency ablation for the facet joint can alleviate the pain from that facet joint temporarily. But unless we look at the whole functional spinal unit and address all the different components that are involved with why the pain is occurring, then we're not going to get long-term results, right? So Danny also said, I was told my spine was unstable from L5-S1 throughout my spine, from C2, etc., etc. Fractures to the bone, hemangiomas in parts, which, by the way, could be normal. Thankfully, still very able. However, with all the fractures, is arthritis expected at each section? To try to do light weights, is this recommended for SI joint issues and back problems? There's with fractures, whether they're compression fractures or different things, if they acutely happen, can certainly cause pain. But if these are things that are gradual changes over time, these do not necessarily have to equal pain as well. And as far as if arthritis is going to occur, and this is not just you in isolation or people that have various different conditions in isolation. The fact is that arthritis will occur for everybody. Everybody. It's not a question of if, it is a question of when. Arthritis is a normal thing that occurs as we get older, period. It is your wear and tear of the joint that occurs as we get older. This is a normal thing that does not necessarily equal pain. As long as we are moving properly, as long as we have the right nutrition, as long as we take care of our bodies, and when we have things that are going on, yeah, it could be okay in certain circumstances to use things like cortisone injections to decrease some of the pain sensations, to then allow us to move appropriately. But if we really want long-term success, we want to use your own body's ability to heal. We want to use things like PRP or bone marrow aspirate cells, things to actually help with the biology of those joints, but also treat the surrounding conditions, the ligaments, the muscles, all the surrounding parts, all the things that are involved in the functional spinal unit to get better benefit long term. But I kind of got sidetracked here. We weren't supposed to talk about treatments. We were just supposed to look at MRIs here. Well, I hope this was helpful for you. Michael, come to New Jersey. Shoot, man. I'm actually from Jersey originally, and my parents have been trying to get me to come back to Jersey for a long time. But as of now, Los Angeles and Southern California is home. Be more than welcome to come out here and take a little vacay, get a little treatment vacation if you're interested. But you're requesting some video on subluxation, overlapping facet joints, how to get regen, etc. Couple weeks ago, take a look at my MRI video on normal. I believe I talked a little bit about movement, spondylolisthesis, and subluxing of the joints. And I will definitely talk more about regen videos. If you want to see some of my older videos, I've talked about a lot of different topics. Go to my website, fxregencenter.com. That's F as in Frank, X as in X-ray, regen, R-E-G-E-N, center.com. I have a YouTube channel, but I think all my videos are being placed onto our website as well. You can always scroll back through Facebook and look at all the lives that we've done there. I hope this was really beneficial for you all. If you have any questions or further comments, then please feel free to comment. You could DM me, or you can contact my staff at info@fxregencenter.com. Danny, also, do you know anything on spina bifida occulta? Spina bifida occulta is a completely different topic. There are various different causes, genetic being one of the more common causes of that. And again, this is one of those conditions that does not necessarily cause issues. However, can involve things like tethered spinal cord and things along those lines that are more important to analyze. If you have specific questions about your condition, Danny, I'd suggest if you want to discuss your case more in depth, certainly contact my education center. My staff will be able to help you, and we can even always do a telemedicine visit. So for all of you, including Michael across the country, I do telemedicine consultations, second opinions if you have things that you're concerned about what your physicians are doing. But you know, I'm going to keep on putting out this material. If you have questions that you want me to address in one of these videos in the future, if you want me to address specific topics, then let us know. Again, comments, DMs, email at info@fxregencenter.com. If you like this, please share it, like it, spread the joy. You know, send it to your friends, your family, and your enemies. I wish you all the best of luck. Have a great weekend, and I will see you next week.